Useful basic cardiovascular examination skills in an emergency setting. The pulse points of the body. Identify as many of the pulse points shown in the diagram on your own body using your 2 or 3 middle digits and moderate pressure. Identify the carotid, brachial, and radial pulse points on a volunteer friend's body using your 2 or 3 middle digits and moderate pressure. Measure the systolic blood pressure with palpation. Acquaint yourself with the different parts of the SPHYGMOMANOMETER. Identify the following anatomical landmarks: the humerus bone, the biceps muscle, and the brachial artery in the upper arm, as well as the radial artery in the wrist area. Place the cuff snugly around the upper arm at the level of the heart and about 4 fingers above the elbow. Place the middle 2 or 3 digits of one hand on the brachial artery, distal to the cuff, and palpate the pulsating brachial artery. Alternatively, palpate the radial artery instead of the brachial artery. Close the pressure control valve and inflate the rubber bulb to inflate the cuff about 10 to 20 millimeters mercury beyond the point where the artery's pulse is no longer discernible. Gradually release the pressure by opening the pressure control valve slowly, keeping your finger digits on the brachial or radial artery. Make a note of the pressure on the blood pressure meter at the point at which you start feeling the pulse again. This reading represents the systolic blood pressure. Important notes: when using the palpation method, the systolic blood pressure reading is usually about 5 to 10 millimeters mercury lower than the pressure measured by the auscultation method. It is not possible to measure the diastolic pressure accurately without a stethoscope. In hypotensive patients, it is challenging to measure the blood pressure accurately with a palpation method. If you have a stethoscope at your disposal, you can determine the blood pressure using the auscultation method. The stethoscope should be placed over the brachial artery in the cubital fossa area. Increase the pressure in the cuff to about 30 millimeters mercury above the expected systolic pressure. Decrease the pressure in the cuff slowly until you hear the familiar carot cough sounds. This is the systolic pressure. Continue decreasing the pressure slowly until the carot cough sounds disappear. This is the diastolic pressure. Note the blood pressure as follows. Blood pressure equals the systolic pressure over the diastolic pressure in millimeters mercury. The blood pressure cuff can serve as a pneumatic tourniquet for the upper or lower limbs in an emergency or disaster setting. If used as a tourniquet, the helper should ensure that the pressure in the cuff remains above the systolic blood pressure. If the bleeding starts again, increase the cuff pressure. Determining the heart rate. When reviewing the body's pulse points, it is as simple as counting the number of pulsations, or beats, at one of the pulse points in 1 minute to determine the person's heart rate. Counting the number of beats in a 30-second period and multiplying this number by 2 is acceptable in an emergency setting where time is of the essence. Evaluate the capillary refill time. Apply pressure to the nail bed until it turns white, or blanches. This indicates that the blood has been forced out of the capillaries. Once the tissue is blanched, the pressure is instantly removed. Measure the time it takes for the normal pink color to reappear in seconds, indicating that blood is returned into the capillaries. The normal pink color should return in less than 2 seconds after pressure is removed. Determining the respiratory rate. The respiratory system is intimately associated with the cardiovascular system in supplying oxygen to the cells of the body. The respiratory rate is defined as the number of respirations, in other words, the number of inspiration-expiration cycles occurring in 1 minute. In a clinical setting, the examiner will count the number of chest rises in 1 minute.